Corticospinal tracts. The upper motor neuron refers to nerve lesions right from the cerebral gray matter, the corona radiata, internal capsule, fibres passing through the midbrain, the pons, the medulla, and the spinal cord above the level of the anterior horn cells, while the lower motor neuron refers to anterior horn cell down to the nerve root, the ganglia, the nerve, the myoneural junction, and the muscle. Below the lower medulla, there is ipsilateral weakness, and above the lower medulla, there is contralateral weakness, and this is because the corticospinal tract fibers cross over to the opposite side in the lower medulla. Lower motor neuron lesions are always ipsilateral when it comes to weakness. Features of upper motor neuron lesions include wasting, which is mild compared to lower motor neuron lesions, increased tone or spasticity, brisk deep tenon reflexes, clonus, and extensor plantar response or a positive Babinski sign. Lower motor neuron signs include excessive wasting, flaccidity, suppressed or absent deep tenon reflexes, and a flexor plantar response or a negative Babinski sign.